Good evening, everyone. This is Cindy Pankella, the Senior Director of Physician Services at the American Osteopathic Association. Thank you for joining us this evening for our feature, Federal Financial Relief for Physicians During the COVID-19 Emergency. A little housekeeping before I introduce the speaker. This webinar is being recorded and it will be available for CME. To obtain your CME credit, you will need to go back to the AOA online learning platform, and within the course for this webinar, you will find the post-evaluation. Go ahead and take that. You will be able to download and or print your certificate. However, we will be reporting the CME to the AOA CME department. And so, to our speaker, David J. Pugach is most of you I'm sure know, but he is AOA Senior Vice President of Public Policy, leading advocacy efforts in Washington, D.C. Before joining the AOA, David was previously Vice President, Federal Relations for the American Cancer Society Cancer Action Network, where he also served as the Executive Director of One Voice Against Cancer, which is a coalition of 50 patient and professional organizations. Before joining the American Cancer Society, David was Deputy Director of the Office of Government and Congressional Relations at the National Institutes of Health National Cancer Institute and was detailed to the U.S. House of Representatives Committee on Appropriations. He is a graduate of George Washington University and received a Juris Doctorate from Rutgers University School of Law, and he is a member of the Maryland State Bar, and we are pleased to have him present with us today. David?
Cindy, thank you so much for that very kind introduction. Good evening, everyone, and thank you so much for making time to join us for this webinar. Just a few housekeeping items on my end. First, I have no financial conflicts of interest to disclose. Also, just as a brief disclosure, the purpose of this presentation is to provide an educational overview, general information intended for all of you as a whole, and not necessarily specific to the individual circumstances for any one person. Everybody is encouraged to review all official source material and federal guidance, but as of the date of this webinar, the content being provided is accurate, but attendees are encouraged to seek out specific guidance and content relevant to your own individual circumstances. So with that said, let me turn to our learning objectives for tonight, which first and foremost, to help everybody develop a better understanding of federal programs and funding opportunities intended to support physicians and other healthcare providers during the current COVID-19 emergency, to identify actions that physicians need to take in order to apply and secure federal funding, and lastly, to increase your working knowledge of opportunities, deadlines, and limitations associated with funding. So obviously, the COVID-19 pandemic is a major public health problem in this country, certainly something that everybody understands and appreciates. And why we're holding this webinar, why many of you presumably are watching, is to learn how to try and mitigate the financial impact. The financial effects are, to a certain extent, a byproduct of the need to try and control the spread of disease. So why are we currently having to take the steps that we've taken for social distancing to limit physician access to your practices, perhaps to employ telehealth measures? Well, first, there is a real problem, which is that people might take up to 11 days before they develop symptoms and show signs of infection. And in fact, if you'll take note of that box on the right-hand side of the screen, one thing that has been discovered is that people are actually at risk of spreading the virus for about a week following infection, but before they're actually showing signs of symptoms. So there are a number of real challenges associated with controlling the spread of the virus. One, it's contagious, and people do not know that they have it. Again, one of the challenges we face is that since this is a new novel virus, as it's being called, we don't yet have FDA-approved treatments for the virus. There are obviously anecdotal examples of treatments that are showing to be effective in some patient populations, but the treatment options for people who are severely ill are limited. And obviously, we want to control the spread of the disease, which is often being referred to as, slowing the, flattening the curve, and that's what we're working toward. The disease certainly is progressing. We've seen incidence rising. So as of April 24th, we're approaching 900,000 confirmed cases in the United States, and we have crossed the milestone of 50,000 confirmed fatalities in the United States as well, as a direct result of COVID-19. So the goal, as I mentioned, flatten the curve, limit the spread, reduce the outbreak, and ultimately try and keep the healthcare system from exceeding its capacity to provide appropriate care for patients. Unfortunately, we know there are real-world consequences to that. We've seen that in the economy as a whole, and we know it's taking a toll on physician practices, and we want to make sure that people understand how to mitigate the financial impact that's being felt around the country as well, which is what we're going to be focusing on primarily tonight. Of course, we know that there are stay-at-home orders, shelter-in-place orders across the country. These dates are changing on a rolling basis, with some states preparing to scale back, others extending theirs. But again, if you live in states that have extended stay-at-home orders, there are consequences. There is an impact associated with that, and we want to certainly help you navigate the effects of that. So what have we seen from the federal government to address this? What's happening in states across the country? First, just a quick note for people who unfortunately are losing their jobs and their employer-based healthcare. A number of states have opened enrollment into their healthcare exchanges to allow people to get subsidized health insurance in those states. We also know that there are Medicaid waivers in, I think, every state currently to, again, expand access. It's also important to know for patients who come into your offices as well who may be impacted. What has the White House done? The president issued an executive order on March 13th that immediately led to a large number of changes in how Medicare pays for telehealth. And we've seen that covered in a number of AOA webinars that have been held up until now, I think at least 4 to date, as well as a number of resources on osteopathic.org, which I hope you're aware of and are taking advantage of. We've seen continued change in regulations and regulatory guidance to provide for patient access, payment to physicians. One area that we know is still problematic, and there is a gap in payment, is for audio-only telehealth services, and that is something that the AOA, along with other medical associations, is working to address. So what else? So just to quickly highlight a few of our resources. I mentioned the webinars. I know that AOIA has hosted at least 4 webinars and that are available online. There's a lot of information on payment codes, federal policy updates, CMS telemedicine guidance, links to CMS resources. and you see that URL, which takes you to the Telemed page that is routinely being updated as new information becomes available. So for more information, please go there, and you can also find these on-demand webinars as well. So what else has happened? CMS has taken several other important steps to try and ensure sufficient flow of resources to physicians and other providers and vendors. So I mentioned the broadening of payment for telehealth services, additional flexibility being granted to physicians to allow the use of telehealth in lieu of face-to-face visits. But there was also the accelerated and advanced payment program that was implemented, and that's where CMS has expanded the use of accelerated and advanced payments for hospitals, physicians, suppliers, essentially any entity that participates in traditional fee-for-service Medicare, Medicare Part A and Part B providers. There's a lot of good here, but there are also some challenges that I will touch on as well. So the Medicare accelerated and advanced payments, they can be requested by any Medicare A or B provider. You can request up to 100% of the reimbursement amount for a 3-month period. You do have to meet certain eligibility requirements. They include having billed Medicare claims within a 180-day period immediately prior to the request, not currently be in bankruptcy, not be under active medical review or a program integrity investigation, and not have any outstanding delinquent Medicare overpayments. If you are in good standing and you have billed claims within the last 180 days, you can apply currently. Now, there are some challenges and some important things to be aware of. Repayment, a recoupment process currently kicks in automatically 120 days after payment is received. You have up to 210 days to repay the balance in full, after which the interest rate will be 10.25%, fairly steep. Medicare payments, also future Medicare payments, I should say, will automatically be reduced to repay any outstanding balance instead of fully paying newly submitted claims in full. Now, that is something that is of great concern to the AOA and a number of other physician associations. So we've advocated both in partnership with other associations as well as independently on our own that needs to change. We've advocated that position with both CMS as well as with congressional leaders for inclusion in the next big legislative package around COVID-19. What we would like to see changed is that recoupment is postponed for a year, that the total amount is reduced from 100% to a maximum of 25%. No reason why providers who are suffering now should only be putting off that financial pain, and that the interest rate should be reduced from 10.25% to 0. So that's something that we've been advocating for, and I know other organizations have as well. But also understanding the full package is critical, so that if a provider is going to seek an advance payment, to know what the terms and conditions of repayment are. Now, what has Congress done? Congress has done a lot. There have been 3, now essentially 3.5, I should say, pieces of legislation that have moved. These are almost like Russian nesting dolls. The first one was $8.3 billion. The second, and really just focused on funding for vaccine development, testing, preventing the further spread of virus. That became law on March 6th. The second package, $100 billion, it's called the Family's First Coronavirus Response Act. And that package primarily focused on expanding unemployment insurance, focusing on support for individuals, expanding food stamps, for example, providing some money for educational assistance, knowing people were going to have to go to remote learning, and it expanded paid family and medical leave. One thing that's important to note here is that unfortunately, because there was a concern about having adequate staffing in the healthcare workforce as the healthcare system potentially was on the verge of being overrun, that healthcare workforce employers were specifically exempted from having to participate in these new paid sick leave requirements, something that we are working to remediate. And then the third package, by far and away the biggest, is known as the CARES Act. This is a $2 trillion package that included $100 billion for hospitals and other healthcare providers, $16 billion for the National Strategic Stockpile for medical supplies, for PPE, further expansion of telemedicine, direct payments for individuals and families, and that became law basically a month ago on March 27th. This is where, if you're familiar with, and I know many of you are, the Paycheck Protection Program. This is what funded the Paycheck Protection Program. It was viewed at the time as a huge pot of money that quickly ran dry. So Congress this week passed just a 25-page bill, 25 pages, and yet the price tag is about $475 billion. But that bill added another $300 billion to the Paycheck Protection Program. The president actually signed it into law this afternoon, so that program has been replenished. Additional money went into other small business administration programs, which I'll touch on momentarily, and then additional money that went to HHS for provider relief as well, which I will also expand on momentarily. So I mentioned the CARES Act and these other bills just to highlight, because there are some things in here that are worth mentioning. A lot of funding to directly address the COVID-19 outbreak. There's the $100 billion for grants to hospitals, other nonprofits, and individual healthcare providers. I saw a question that was posted even before we started saying, how can I spend the money? What can I use the money for? If you are getting a provider relief grant, that is money intended to basically try to help make you whole. It's to cover unreimbursed healthcare expenses, to cover lost revenue. So those HHS grants that if you are somebody who had Medicare A and B fee-for-service claims and you received one of those payments over the last couple of weeks, there are no strings attached. Well, I don't want to say no strings attached. There are strings attached, but there's no limit to how you can spend that money. It's intended to cover unreimbursed expenses and lost revenue. And on the right side here, if you're following along with the slides, there are provisions in the CARES Act that allow people with high deductible health plans, health savings accounts, to use that HSA money differently. It allows it to be used for telehealth services. You can use your HSA and flexible savings account, your FSA dollars, to pay for over-the-counter medical products. It ends limitations on expansion of a Medicare telehealth authority. It allows for federally qualified health centers and rural health centers to serve as distance sites. So for anyone who works at an FQHC or an RHC, it allows you to be a distance site to provide telehealth services and be fully reimbursed by Medicare. And it also provides Good Samaritan protection for anybody who is volunteering their time as a healthcare professional, and of course, the financial support for small businesses and nonprofits and individual providers as well. So all very, very important. Again, does not meet all needs, but it is a step forward. So there are a number of small business provisions in the CARES Act. There was the $350 billion for the Paycheck Protection Program, delay in employer Social Security payroll taxes, expansion of uninsurance benefits, 50% payroll tax credit, just to name a few. So let's focus on some of these small business programs. The Paycheck Protection Program makes this so unique, so special, and in such high demand is that if you meet the terms of the program, there is loan forgiveness. I will go into more detail momentarily on that. There is also the Economic Injury Disaster Loan Advance, the EIDL. This is part of a larger small business loan guarantee, but the loan advance is a one-time $10,000 grant, essentially, that does not have, it doesn't have to be repaid. So even though it's considered a loan advance, it does not have to be repaid for all small businesses. This is another program. The EIDL program also ran dry over the past few weeks and was just replenished as of today. So then there's the Small Business Administration Express Bridge Loans. You do already have to be registered with the Small Business Administration to get one of these quick bridge loans. Then there's this Small Business Administration Debt Relief. Essentially, this allows you to have your outstanding debt refinanced and payments made by the SBA temporarily. Not necessarily applicable to everybody. So what I really want to focus on is the Paycheck Protection Program. So as I mentioned, originally it was $350 billion. That $350 billion went very, very quickly. As of this afternoon, $300 billion has been pumped back in. On the right side is just what the first page of a typical loan application for the program looks like. This is for small businesses, hospitals, health systems, individual healthcare providers, practices. You can get a loan for up to 250% of your average monthly payroll costs to cover 8 weeks of payroll. You can cover rent, mortgage payments. You can cover pension contributions, health insurance premiums, your utility payments as well. However, the loans are forgiven based on several requirements. You have to maintain all your current employees and salary levels. So you can't reduce the number of employees or salaries. And you have to spend at least 75% of the loan on payroll expenses. You also cannot pay for salaries or portions of salaries that would exceed $100,000. So now any portion of the loan that would cover costs beyond what is, under the criteria to be forgiven, can be repaid over a period of 10 years with a maximum interest rate of 4%. But I think that most interest rates are pegged at around 1% for this right now. So that's why this is in demand. If you have a practice and most of the salaries in your practice are over $100,000, you have to decide whether or not you want to try and have your loan forgiven or a portion of your loan forgiven. I think I've seen questions pop in. Let me just quickly see some of these questions so I just could see if they're to answer now or let's see. I see Cindy's answering these. Okay, we'll try and get to these later. So that is the Paycheck Protection Program. And the last thing I'll say before moving on is we saw the first $350 billion get accounted for and obligated very, very quickly. I don't know the exact number of days, but I think probably within 2 weeks. I would assume this $300 billion will also move quickly. So anybody who's interested, even if you're not completely sure, the recommendation is always do your due diligence, but don't delay putting in an application. I would say the likelihood that Congress will take up another legislative package very quickly is low. Congress will take up additional legislation to continue to address the COVID-19 and to provide for economic relief. But realistically, I don't anticipate seeing legislation move until maybe sometime close to Memorial Day. So I know following the CME portion of this program, we do have somebody who will talk about how to apply and from one of the AOIA member affinity programs. So if you want to stay on after the CME session ends, you can learn more about that. But this is one of those programs where if you think it's applicable and would be beneficial, you want to look into it sooner rather than later. So there are additional programs out there beyond the Small Business Administration. The Department of Health and Human Services has, first and foremost, the Provider Relief Fund. So in the CARES Act, HHS received $100 billion for grants to cover unreimbursed healthcare expenses or lost revenue that's attributable to COVID-19. That's obviously a fairly broad definition. The big question is who would get the money, how much money would they receive? One of the things that the physician community worked very hard on was making sure that this money would not be targeted exclusively to hospitals and other facilities, that individual physicians and other healthcare providers would receive this money. And to that end, what we saw was the first big distribution was $30 billion that went out to any Medicare fee-for-service provider, and it was based on 2019 claims data. There was a formula that was posted on the HHS website, and that money moved out the door very quickly to HHS's credit. There was definitely a recognition that there were providers, there were physicians, and other institutional providers that were going to be left out if you are not, if you don't have high, Medicare claims data. Somebody, potentially who's a pediatrician is not going to have a high volume of Medicare claims. And so with that said, HHS is very interested, and the AOA is working to provide feedback on where the gaps are. The next chunk of money is going out the door probably next week, and that's $10 billion that's being distributed to hospitals and other facilities in areas that have been impacted by COVID-19. HHS has been soliciting information from these facilities on the number of ICU beds, hospital admissions for patients with COVID-19. I actually had a call with a physician at a critical access hospital earlier today. He has had COVID-19 patients in his hospital, in his emergency room. They've had to prepare for taking in patients. They've had costs that they've had to incur. But because they never admitted any patients, they didn't use up any ICU beds, they might be left out because of this formula. That is something that needs to be obviously resolved and remedied. There is another $10 billion that will be allocated in the near future. Not very well defined how this money will be allocated. Again, not really targeted towards individual physicians. It's again going to hospitals and clinics, oriented around rural health, rural access, and an additional $400 million being directed to the Indian Health Service. Now, the most important thing to know is that when all is said and done, this is $50 billion. A lot of money will have gone out the door in a very short period of time. However, HHS received through the funding bill that was signed into law today, another $75 billion for the Provider Relief Fund. So in total, it has $175 billion, and I say only, and $50 billion will have been allocated probably by the end of this month, but that leaves $125 billion still unspoken for, and a lot of decisions left to be made, which is why knowing where the gaps are and being able to provide that feedback to HHS is going to be critically important. Another very important program, an initiative that was just launched earlier this week, is through a collaboration between the FCC, the Federal Communications Commission, and HHS. And this is a COVID-19 telehealth program. So you heard a few minutes ago, me speak about all of the efforts made to expand access and payment for telehealth services, but there are a lot of providers, a lot of physicians who may be left behind because you might not have the infrastructure to be able to support telehealth already built into your office, into your practice. And so with that in mind, The FCC and HHS are partnering on a $200 million telehealth program that is intended to assist healthcare providers with purchasing equipment, with getting connected online, getting IT, getting high-speed internet, getting the devices needed to provide telehealth services. Additionally, there is an FCC program called the Connected Care Pilot Program, which is really intended to target healthcare providers in rural and underserved areas. And this is really to help getting people truly connected to the internet. It's a $100 million pilot program, so there's going to be data that's collected to find out essentially how effective the program is. Anybody who's interested in this program has to start by registering with the FCC to become an eligible healthcare provider. So again, where this may be useful, there's funding available, $300 million in total, to get online, to get the equipment necessary to be able to provide telehealth services if that's not already something that's built into somebody's practice. Another area that I just want to mention, and I will tell you, in all of my time working in healthcare advocacy and health policy, I have never previously paid much attention to the Department of Agriculture. But there is also $1 billion that was provided through the CARES Act to the United States Department of Agriculture, which for another small business loan guarantee program. So this is for for-profit businesses, nonprofits, co-ops, public bodies, and individuals. So if you are operating in a community with fewer than 50,000 people, you are eligible to get a loan through this program. And it can cover a wide range of costs, and it is specifically intended to support, maintaining operations, hiring, and retaining staff in small communities across the country. It is not specific to healthcare, but it is certainly inclusive of healthcare. And so this is one more opportunity for bridge funding that I want to flag for folks. So obviously, as I mentioned, a lot of money has been appropriated by Congress, and federal agencies have tried to stand up these programs and push this money out the door in a very short period of time. They're not doing everything right. They're not making everybody whole. This is going to be an ongoing iterative process. And so it's important for you to know what resources are available. Cindy Pankala is going to talk in a little more detail about some of the information that AOIA has. But one of the things that I want to just highlight very quickly, when you go to osteopathic.org, right there on the homepage, there's the AOA COVID-19 page, has a lot of useful information, a lot of links to resources, including the webinars I mentioned earlier. We also need to hear from you. We need to know how you're being impacted by the outbreak, by the economic downturn, by the stay-at-home orders, by having patients not coming to the office or canceling procedures. And we need to know whether or not you're benefiting or these are being left behind by these various programs. So there's a number of ways to do that, but one of those is we do have an opportunity for people to share their stories. And so far, we've collected over 100 physician stories. And it really does inform the work that we're doing. And it allows us to know what the impact is, to share with members of Congress, congressional staff, as well as HHS. We also, and hopefully you're seeing the advocacy communications that we're sending out, have action alerts. And these are critically important because members of Congress do pay attention to the voters back home, their constituents, to all of you. And as physicians, whether you think of yourselves in this way or not, you are also community leaders. And so your voice carries even greater weight with them. Just this week, we launched a grassroots action alert, calling on Congress to do a number of the things that I've highlighted here tonight. One is to fix the repayment structure of the Medicare advance payments, to increase Medicaid payment rates to align with Medicare, to provide liability protection to frontline healthcare workers. The CARES Act, fortunately, provides for liability coverage for anybody who's volunteering, but if you are being paid, you don't have additional liability protections, and many people are working in suboptimal conditions. So we are calling for, expansion of federal liability protection for anybody working on the front line. We want federal student loan forgiveness, and we, as I mentioned earlier, we want anybody who is in the healthcare workforce to have the same expanded paid medical leave that was granted to the rest of the country. In the Families First Act, which was the second COVID-19 legislative package. Just this week alone, we had more than 2,000 individual messages sent to members of Congress from their constituents. Over the last month, we've had more than 10,000 individual messages to lawmakers, and they are paying attention, but we really need everybody to lend their voice if we're going to make these changes happen in the next round of legislation. So with that, Cindy, I'm going to turn it to you to take everybody through some of the additional resources.
Hey, David, I think Cindy, we can't unmute her, so if you can run through this, that'd be great.
Okay. No, thank you for letting me know. I'm happy to walk through it. She's not able to walk through, so I can hopefully do the best I can to fill in for her. As I mentioned, there is the AOA COVID-19 landing page that has a lot of great content. There are a number of webinars on telemedicine, navigating HIPAA in telemedicine, and of course, making sure that physicians are able to get paid and understanding the new documentation requirements, as well as a number of both public and private payer coding changes as well. And you see the URL at the bottom, AOAonlinelearning.osteopathic.org for all of this information. There are also several upcoming webinars. There's one next Wednesday, April 29th, the CARES Act and the Paycheck Protection Program, key considerations for physicians and their practice. I obviously ran through a very broad and brief overview of the Paycheck Protection Program, so this will be a much deeper dive. On May 6th, keeping your practice in shape during the pandemic, and then May 13th, managing your online presence. Telemedicine, there are several platforms out there. You see Cirrus Health has remote monitoring of COVID-19 patients, and then there's free COVID video consultations through Bluestream Health. Again, you see the URLs at the bottom, osteopathic.org/member value. And if you have any questions, membervalue@osteopathic.org. So to obtain CME credit for this session, you go to AOAonlinelearning.osteopathic.org and log in. I'm sure it's something that you are all quite familiar with. And I think with that, I will see if you see obviously the physician services phone number and email address, and obviously they are fantastic. You can answer just about any question or find somebody who can. But if there are any questions tonight, before we end the CME portion of the program, I'm going to please enter them into the Q&A chat, and I'm going to start reading through them now, and we'll just answer them live. So I mentioned at the outset, somebody asked the question right when we were starting at the top of the hour, do you know exactly what the HHS stimulus payments must be used for? And if you received a grant through the Provider Relief Fund, you can use it for any purpose. Second question, I applied for an EIDL Economic Injury Disaster Loan 414. I'm a sole proprietor. No one at SBA would answer my question of what line to put my expenses for Schedule C. This question, we'll have to, that's not something that I can answer about that application. It's not something I have significant familiarity with, but I would say please email the physician services, and if you still haven't received funding, and we can follow up with you. Independent contractors and the PPP, the answer is they should be able to apply for PPP funding as well. On the application that I had a snapshot of, at the top of that first page, there's a number of boxes that any applicant can check to find the one that's appropriate for you. I believe that independent contractors and sole proprietors, well, you are your own employee as a sole proprietor, but also I suspect these are some of the questions that Aaron may be able to answer when he presents next as well. Is there any discussion about including student loan repayment or forgiveness in any future legislative packages? That is something that we are actively advocating for. We've done grassroots on that. We actually partnered with the Student Osteopathic Medical Association last week on an action alert and had, I'm going to say, just under 2,600 emails specifically on student loan forgiveness. And it's something that's part of our current action alert that I highlighted a moment ago, as well as something that the AOA has been directly lobbying on. But so far, no, there's no real firm details on what will be in the next package. For individual stories, I will work with physician services to send out the link to where people can submit those. And somebody, let's see, asked for the physician service contact info and the slide with the CME link. So it says, what's the PP? And then the last question we have in the queue right now, before I go back to those other slides, with the PPP loan, is payroll review at the end of the 8 weeks going to be based on annualized income? I don't know the definitive answer to that question. What I would expect is that it would be based on the payroll information that's submitted in the document as part of the documentation at the time the application is filed, and verifying that those payroll levels have been maintained. But I've not seen any documentation, and I don't know if that's something that would come from the Small Business Administration or a lender. Aaron may be able to answer that, but I don't mean to put that on Aaron either. It's a good question, and I think we'll have to, I at least do not know the answer to that. So I'm going to real quickly go back to the two previous slides that folks were asking about seeing, and then I will and I'll see if there's any more questions, and if not, I will turn things over to Aaron. So for CME, here is the URL, aoaonlinelearning.osteopathic.org. I will pause here. And physician services, 312-202-8194. That number again, 312-202-8194. Or they can be emailed at physicianservices@osteopathic.org. And let's just see if there's any more questions. And if not, I will turn things over to Aaron. So I see question, what's the procedure again to obtain CME? And above that, do you know the limit of Medicare patients required to qualify for the CARES Act? About 300 patients bought PPE and seen COVID patients, have not seen a reimbursement check and told we don't qualify. Please follow up with us. There's probably information that we can share. We can give you a number to contact. The answer to that question, to my knowledge, is that on that first wave of funding, the initial $30 billion, that that money was paid out strictly based on 2019 fee-for-service claims data. The first 30 billion, it had nothing to do with whether or not you've seen any COVID-19 patients or have, purchased any PPE. It was strictly, do you have Medicare A or B fee-for-service claims data from 2019? And then there was a funding allocation based on that. And all providers, including individual practices and physicians, should have received payment if you had an allocation based on that formula. This next wave of funding is being distributed to hospitals and other facilities based on COVID-19 related hospitalizations. And then beyond that, further tranches of funding, I think how they're allocated is still to be determined for the most part. So I think it'd be helpful for us to find out exactly what the situation is and help at least direct you to making an inquiry on that. And so with that, Aaron, if you are ready, I will hand things over to you.
And actually, this is Cindy. I was able to get unmuted. I apologize. I was actually kicked off the computer, signed back up on my phone. So I apologize, but great job, David. Thank you very much. Great information. And as David did well, providing the way to reach physician services and such. So this concludes the CME portion of the webinar, but as David mentioned, and as many of you are aware, the AOA Member Value Program partners with SoFi to provide financial solutions for our members. And as a result of the overwhelming demand from the members looking to access the initial round of the PPP funding, SoFi has built a marketplace for physician practices and other small businesses. This new marketplace allows members to easily shop across multiple lenders and compare financial solutions, including those that are part of the SBA Paycheck Protection Loan Program, or PPP. And we're excited to be joined today by Erin LaBrue. And thank you, Erin, for me being able to text you and you telling David what was going on as I got kicked off. And Erin is the product director for this new marketplace called Lantern. Erin and his team have been working tirelessly with their partners to create Lantern and simplify the process of accessing the SBA PPP funds for members. And I'm going to turn it over to Aaron, and he'll provide you with an overview of the Lantern Marketplace. Aaron?
Hey, everyone. Thank you for that, Cindy. What a wonderful intro. I hope I live up to the bar here. So my name's Aaron. Like Cindy mentioned, I'm a director of product here at SoFi. I operate our marketplace offering, and I've been working in the PPP space. So I wanted to give you a quick overview of the program, some of the results from the first round of funding, and then some information on how you can find a PPP lender by working with us. David, if you don't mind, can you flip through, or do you want me to share my screen here?
I can do whatever you want. I thought I had given you control, but I can certainly do it if it's helpful.
Look at that. We're learning in real time here. I have control over it. So a little bit of background about the company. SoFi is a financial services company. We've been around for about 7 years, and we have a pretty broad product offering. It's mostly delivered online. We offer student loans, personal loans, mortgages, wealth management, and checking and savings accounts products. We're really focused on serving our customers. We have served over 1 million users so far, and we're adding about 20,000 new accounts every month. All of our products, tools, and resources are really focused on our mission, which is to help get your money right. And our goal is to really holistically serve our customers. We focus on delivering best-in-class web and mobile experiences and really try to drive innovation in all the categories that we serve. So just a little bit of background on the partnership. We partnered with the AOA in 2018. And we want to be the partner to serve all the needs of this group. We offer some rate discounts for student loan refinancing. For the cases where private student loan refinancing actually makes sense, I'm sure some of you are in forgiveness programs. We also have some welcome bonuses on the personal loan side. We've been able to help refinance about 63 million in AOA members' student loans to date, which is pretty awesome. So I'm here to talk about what we've been doing with the AOA and how we can help you get PPP loans. I'm sure you've seen a lot of news. I wanted to start with some data and just kind of walking you through the numbers. As David mentioned, the CARES Act funded about $350 billion for this kind of relief effort. And this is a breakdown that Ernst & Young put together that kind of shows where the money went, which I think is super interesting. You hear a lot about some of these major corporations taking up a lot of the funds. Well, that is not totally true. The percent of, on a business basis, the bulk of the funds actually went to loans that were $150,000 or less, which is pretty good. From a processing perspective, the banks really tried to focus on those small business segments as best they could. The other thing that I think is pretty interesting here is the sectors where this went to. Pretty evenly distributed, and you can see healthcare and social assistance there, which you guys would fall under, was about 12% of the total funds. Still, I think there's estimates that there's over about $1 trillion in demand for this program, and the initial round of funding went very quickly. The CARES Act went into effect on March 27th. I think the program itself opened with the SBA on the 3rd, which also happens to be the same day we launched our marketplace, and funds were depleted by the end of day on the 15th of April. So it was about 12 days there to get in, and there were a lot of issues getting access. So it's, you know, don't want to name and shame here. I think the SBA is trying to figure this out. Everyone's moving very quickly, and it's really no one's fault. This is a crisis response effort, but the rollout has been pretty rocky. There were a limited number of banks that were approved to do these. You had to be an SBA approved lender prior to this program going into effect. There was a lack of clarity in the program and some of the terms, and so some major banks were concerned about fraud and risk issues and had to wait for the SBA to issue guidance on how the risk would shake out, and that kind of led to a delay in serving their customers. There have been a number of technical issues with the SBA process, and I think what you're seeing is demand's not evenly spread. The banking industry is pretty consolidated with some large banks. You know, community banks and credit unions actually had some capacity, and they just didn't have the demand. And so there's been a market matching kind of miss here, which kept people from getting funding. The SBA, Treasury, and the Fed have taken actions lately to solve some of these issues. They authorized some fintech companies, some financial services technology companies, to do loans directly, which I think has been a huge lift, and we've been able to partner with some of them. They've improved liquidity by opening up the Federal Reserve, so some of these lenders don't need to lend based on funds on hand, and they can do more loans than they would otherwise normally be able to do. And there's a lot more clarity on the process and how these loans work. I think the first couple to get through were tough, but now that everyone knows how it works, we expect this next round to be a lot smoother and go a lot more quickly. And so at SoFi, I operate our marketplace product, and we saw this as an access problem. If you are working with your major bank and they're not being responsive, then you need to find someone else that can help you get access to this program. We've even seen some large institutions recommend that their users go elsewhere just because the small business is not large enough to get prioritized, which is kind of disheartening. So what we've done is we've partnered with a bunch of small business lenders. We actually have access to hundreds of SBA approved funding sources on the back end of our marketplace. We are trying to kind of smooth out where people are routed. And so there's some recommendation around which partner we think is best for you based on your loan size and industry. And then we also know that this is going to be an ongoing effort. It's not just about PPP. Who knows what the next stimulus packages are going to include. I see some of you here have applied for EIDL. That went pretty quickly, and they had way more demand than they could fulfill. And so as things evolve, as new packages get passed through Congress and turned into law, we're continuously updating the offers in our marketplace to make sure that you get the best information and have all the options kind of laid out for you to understand how to keep your business afloat during these times. So going to hit you with the link here, and then I'll answer some questions. To find a lender to work with, you can go to lanterncredit.com/smallbusiness. I think Cindy might be able to share some of the links or resources on the AOA side as well as part of our participation in the member value program. And yeah, if you have questions, go ahead and throw them in the chat window here, and I'll kind of go back through. David spoke to some of these, but let me see if there's any that we're hanging over that I can talk to. There's a few questions about independent contractors. I can't speak too deeply on this one, but I will say that the guidance that we're hearing is if it depends on how you're paid. So if you are paying yourself on the payroll, then generally that can be included and qualifies for the program. If you were not, and maybe taking your distributions in other ways that are more tax efficient, then it's probably going to be tough. But I would highly recommend that you ask questions to a lender, and they can give you more specific answers based on your situation. Let's see here. With a PPP loan, is payroll review at the end of 8 weeks going to be based on annualized income? I think David actually spoke to that one. There's another question here from Anthony. For the PPP, does the money received need to be used in 8 weeks to be forgiven? Yes, that is a pretty critical part of the program. You need to use the funds within the 8 weeks, and I believe, don't quote me on this, the lenders can answer your question more specifically, but I believe it's based on the distribution date of the funds, and that's when the clock starts ticking. Whatever funds are not used, convert into a loan based on the terms of the program. And it's also true with funds that were used for cases that don't qualify for forgiveness. The loans have pretty favorable terms, if I do say so myself, and you are welcome to continue to use them outside of the forgiveness window or forgiveness purposes. There's also no prepayment penalties. So if your business is in a good place at the end of this and you want to just give the money back that wasn't used, you have that option as well. Let's see here. What happens if you want to rehire staff at full pay, but they do not want to come back because they're happy with unemployment? Super interesting question. There's some pretty generous unemployment benefits around different states and counties right now. The long and short of it is you can't hire back an employee that wants to qualify for that program, and they shouldn't be calculated in the payroll calculation as far as your loan goes, is my understanding. And then as long as you make sure to distribute the funds without them, like everything should be qualified within that forgiveness window. And so you want to adjust the amount up front, and then you want to make sure that you don't overpay anyone outside of the qualifications of the program, if that makes sense. Any other questions here? Okay, well, thank you all for your time. I really appreciate it. Like David mentioned before, the bill was passed today. There's about $300 billion that's available for relief right now. We think it's going to go very quick. I see there's another webinar David mentioned on the 29th. I don't know that the funds are going to last that long. There was a very large backlog of apps for people who didn't get served in the first wave of funding. We've seen a an incredible amount of demand in the 2-week gap kind of between these bills passing, and all of our lender partners have been accepting full applications so that their customers are ready to go as soon as the SBA opens up the portal for approval. So if you think this program might be a good fit for you, if you're at all interested in applying, I would highly encourage you to do so over the weekend. Again, you can find the lender by visiting the URL on the screen. And if you have any questions, you can send them to the AOA, and they're welcome to pass them my way. I'm happy to help.
All right. Well, thank you very much, Aaron. Thank you, David. And great information out there. And we all will get through this. Everybody stay safe. And this concludes the webinar. Thank you very much. Have a great evening.